Good afternoon, ma'am, and good afternoon, classmates. Today we will be reporting about adolescence. What is adolescence? It is between the ages of 12 to 19, and it is often characterized as a period of transformation, primarily in terms of physical, cognitive, and social relational change. Transitional phase of growth and development between childhood and adulthood. It is also a period of development that occurs after childhood, but before adulthood. The first stage of adolescence is early adolescence. This is when puberty begins, rapid physical changes occur, and relationships with close friends take precedence over family relationships. The second stage is middle adolescence. Physical development. It begins with puberty. Development of primary sex characteristics, genitalia, and secondary sex characteristics. Rapid growth of skeletal and muscular systems caused by hormonal activities. The increased hormone production also affects hair production and skin changes. Physical development. There are two types, which are the primary sexual characteristics and secondary sexual characteristics. The changes in males is that, primarily, penis and testes enlarge, sperm starts to be produced, and secretions are released from the prostate gland. Secondary consists of growth of chest, pubic, and armpit hair. The voice deepens because of changes in the larynx. And changes in the female, primarily, ovulation occurs, menstruation begins, uterus and vagina grows. Secondary, the breasts develop, growth of pubic and armpit hair, and the body changes, such as hips widen and waist narrows.
Physical development. Physical changes are visible to all and highlight the range and pace of change. This sometimes leads to adolescents feeling more or less mature than others. Physical development growth spurts occur about 2 years earlier in girls than boys. 3 phases of adolescence. Early adolescence, 11 to 14 years, a time of rapid pubertal change. Middle adolescence, 14 to 16 years, pubertal change are now complete. Late adolescence, 16 to 18 years, the young person achieves full adult appearance and anticipates assumption of rules. Cognitive development. Adolescents develop more advanced reasoning skills, including the ability to explore a full range of possibilities inherent in a situation, think hypothetically, and use a logical thought processes. Piaget termed this stage of cognitive development as the period of formal operations. They are capable of abstract thought and the type of complex logical thinking described as propositional reasoning, as opposed to syllogistic reasoning. Their ability to reason is both inductive and deductive, and it can be hypothesize and apply the principle of logic to situations never encountered before. Formal operational. Thought enables adolescents to conceptualize invisible processes and make determinations about what others say and how they behave. With this capacity, teenagers can become obsessed with what they think as well as what others are thinking, a characteristic known as adolescent egocentrism.
Adolescents are able to understand the concept of health and illness, the multiple causes of diseases, the influence of variables on health status, and the ideas associated with the health promotion and disease prevention. Adolescents recognize that illness and disability are processes resulting from dysfunctions or non-functions of part of the body, and can comprehend the outcomes of prognosis of an illness. They also can identify the health behaviors, although they may reject practicing them or begin to engage in risk-taking behaviors because of the social pressures they receive from peers as well as their feelings of invincibility. Omrod 2012, Elkind 1984 labels this second type of social thinking as the personal fable. According to the neuroscience research, adolescents' brains differ from adult brains in the way they process information, which may explain that adolescents' behaviors such as impulsiveness, rebelliousness, lack of good judgment, and social anxiety stem from biological reasons more than environmental influences. Packard 2007. Erickson has identified the psychosocial dilemma adolescents face as one of the identity versus role confusion. Children in this age group indulge in comparing their self-image with an ideal image.
Adolescents find themselves in a struggle to establish their own identity, match their skills with career choices, and determine their self. They work to emancipate themselves from their parents, seeking independence and autonomy, so that they can emerge as more distinct individual personalities. Teenagers have a strong need for belonging to a group, friendship, peer acceptance, and peer support. They tend to rebel against any actions or recommendations by adults whom they consider authoritarian. Their concern over personal appearance and their need to look and act like their peers drive them to conform to the dress and behavior of this age group. This developmental stage emphasizes the development of autonomy, the establishment of identity, and future orientation. Establishment of autonomy occurs when the adolescent strives to become emotionally and economically independent from their parents. For short-term learning, use one-to-one instruction to ensure confidentiality of sensitive information. Choose peer group discussion sessions as an effective approach to deal with health topics such as smoking, alcohol, and drugs use, safety measures, and obesity and teenage sexuality. Share decision making whenever possible because control is an important issue for adolescents. Use face-to-face or computer group discussion, role-playing, and gaming as methods to clarify values and solve problems, which feed into the teenagers' need to belong and to be actively involved. Getting groups of peers together in person or virtually can be very effective in helping teens confront health challenges and learn how to significantly change behavior.
Next, we have here the long-term learning. The existence of an imaginary audience and personal fable can contribute to the exacerbation of existing problems or cause new ones. So, the long-term learning strategy involves the acceptance of the adolescent's personal fable and imaginary audience as valid, rather than challenging their feelings of uniqueness and invincibility. Another is to acknowledge that their feelings are very real, because denying them their opinions will simply not work. Lastly, for the long-term learning strategy, allow them the opportunity to test their own convictions. Let them know, for example, that although some other special people may get away without taking medication, others cannot. Suggest, if medically feasible, setting up a trial period with medications scheduled further apart or in lower dosages to determine how they can manage. Although much of the patient education should be done directly with adolescents to respect their right to individuality, privacy, and confidentiality, teaching effectiveness may be enhanced by including their families to some extent. The nurse as educator can give guidance and support to families, helping them to better understand adolescent behavior. Parents should be taught how to set realistic limits, and at the same time foster the adolescent's sense of independence. Lastly is the nursing intervention. Adolescents learn health behaviors in a socio-cultural context of community, family, and peers. Although many adolescents engage in behaviors that protect and promote health, others engage in behaviors that threaten or compromise their health. So, nursing intervention includes assessing the stress levels and letting them explore emotional and financial support. The nurses engage with teaching without parents present, but with adolescents' permission-informed family of content covered. So these are our references. Thank you for listening.